Sciatica is the name for pain that's radiating along the sciatic nerve. It's usually coming from the low back. A lot of times when people have sciatica, it's hard to do things like putting on their socks, their shoes, bending over. And the reason that is, pretend this is a nerve. A healthy nerve has the ability to do a couple of things. It should be able to stretch, have a little bit of give to it. Not a lot, but a little bit of stretch and a little bit of give, elongation. And it should be able to slide past other tissues. So there's a space in the spine called the intervertebral foramen, and that nerve should be able to glide past that. And when it loses its ability to do those two things, usually because it's inflamed or aggravated by something like a disc bulge, it's one of the more common reasons. But when that happens, think it's, supposed to leave here. Just think about it being a little bit more stiff, tight, restricted. It can't slide and it can't stretch. So when you go to put on things like your socks and your shoes or you bend over, you get that pain back here or you get the pain down the leg. So in this video, what I want to do is I want to talk about safe stretches for sciatica or for this nerve tension. I'm going to talk to you about nerve flossing techniques directly for the nerve itself and some accessory stretches that you can do around the tissues. I would urge you, caution you, if you do have severe back pain, if you have any kind of back pain, potentially check with your own primary care physician, spinal health specialist, just to make sure that these aren't contraindicated and that they'd be okay for you. But the first one is this nerve flossing technique is we are going to, a lot of times you'll notice if you bring this leg out like this here, that you might get that tension there. And that's who this video is for. If you go out here like this, you're like, ooh, I feel that there. Especially if it's worse going this way and feels better as you look up. That's one of the big key indicators that this is probably going to be a successful stretch for you. So if you don't have that, it doesn't mean you can't do this stretch because this is a very safe stretch, but it might not be the most effective stretch for you. So you might want to go to the next part of the video. But if that is the case, ooh, I feel that and it's worse here and up here. The reason for that is, and the reason is important because if you understand the reason, you're going to understand how to make this stretch perfect for you. Make this stretch your own. And the reason is this. When you come out this way, you're stretching all along that sciatic nerve there. You're tensioning that nerve. Well, when you look up, you're putting slack in the nervous system here, your spinal cord. You're putting slack in that nervous system. When you look down, you're tensioning it there. And those are important components and concepts to understand nerve flossing. And one other component of this too is, and this is another thing that you can do, is when I go out like this, if I flex my foot this way towards my body versus taking it this way away from my body, does that influence or change what you're feeling here? And the same idea, when I go this way, more tension. If you're starting to feel stuff way up here more with that, big chance you've got nerve tension. If you go this way here and it takes it away, big chance that that's that nerve tension there. And you use all of these things as part of nerve flossing. So let me give you some examples on how you can make this mobilization technique your own. And I call it a mobilization technique, and this is important to understand too. It's not a deep sustained stretch. Nerves, irritated and inflamed nerves, they do not do well with a real long, sustained stretch. They do better with coming in and out of the stretches. So for example, I like to just kind of interlace my fingers and have my leg rest on that there rather than use my hip flexor strength to hold it up. But do what works for you. So you're gonna be in here and you kick that leg out right to the point that you feel some of that tension there. And then the recommendation is put tension on one end and slack on the other end. And then it's thought, go the other way. Now put tension going up this way by bringing your chin to your chest. But then your knee is bent here, and you'd go back and forth and do this a half a dozen times, a dozen times, until it starts to free up for you. And then again, you can use a little bit of that nerve this way here. So some nerve flossing could simply be this here back and forth. And then you might find, hey, that's actually loosening up what I'm feeling in here. Now I do this and I don't feel it so much in there. So these are all your nerve flossing techniques. That one in particular is called a slump slider. There's another technique called a tensioner technique, and that's where you tension it on both ends. So you do something like this here. We're going to come out this way. Maybe even add that extra tension with the foot towards the body this way, and then bring the chin to the chest here. And then you might find, ooh, wow, I really feel that there. The idea with a tensioner, again, it's not to hold it as long as you can, but to hold it for 4, 5, 6, 7 seconds, somewhere in there. So you hold it, and then come out of it. Hold it, and come out of it. And you'd go back and forth. And same thing, maybe you only need to do it 4 or 5 times. If you have to do it more than a dozen times and you don't get any results, or especially if it gets worse, this probably isn't the stretch for you. We need to find you something else. But that's the basics of these nerve flossing, nerve mobilization techniques. So hopefully you understand that. Now, there's a couple of other things, and these are the really popular common stretches, and people know this a lot, but you know, that sciatic nerve's right back here. Well, doing something like a piriformis stretch. So a piriformis stretch could be as simple. If you're seated, you could just cross one ankle over the knee. That's to get this side here in this case. You want chest up, because if you're rounded here, you're slouched and slumped, and that takes the stretch out of the hip area. It's when you come up, you sit up tall. And then when you lean forward, you don't lean forward like this. You sit up tall and you lean forward like this. And you should feel a nice stretch there. Now, this is one you could actually sustain and hold. Breathe, because this isn't nerve tension. Now I'm actually at the point where I'm trying to stretch the surrounding muscles. Now, the exception to that is it hurts, or if it's causing radiation going down your leg, then in that case, I wouldn't recommend sustaining that stretch. I'd come in and out of it. But if it's just back here and local, you could hold that for 20 seconds, 30 seconds, and come out and do that a few times. And I'm a big fan of sometimes getting the other side just for back tension in general. A lot of us kind of have this thing where our back hurts, the back muscles get tight, they pull our pelvis this way here, and then that causes more compression on the spine. So sometimes if you get to the other side, you'd be in this half kneeling position, the knee that's down, you'd think, kind of pull that up just a little bit. Because a lot of people do the stretch and they arch too much in their back. So if you were to just pull this up just a little bit and come forward, you get a nice good stretch here. You could even, I'm going to face you a little bit more, if you wanted to get really big with this stretch, you could bring this arm up overhead and then lean to the side. So those are the basics of nerve flossing techniques, safe stretches for sciatica. I hope you got something out of this video. If you did, please encourage me to make more videos for you. Give us the thumbs up. Subscribe to our channel is even better. And then, of course, if you have any questions, leave them in our comments below.